Mahsa Tehrani, board-certified rheumatologist, who knows a lot about all of this stuff.
What happened was in 2002, the Women's Health Initiative released some findings that scared a lot of people. There was a nationwide panic about the potential risk of hormone replacement therapy linked to possibility of breast cancer and cardiovascular disease. Overnight, millions of women were taken off the hormone replacement therapies. Doctors stopped prescribing them, and medical school education basically dwindled. They don't talk about it anymore. And what this translated into is a generation of women who didn't have the proper support during such a critical time of transition in their lives. And just last year, this study was reanalyzed, and they said, wait a second, we take it back. We don't think that the harms are that great. And essentially today we have enough data to support that hormone replacement therapy, if started within the first 10 years of menopause, especially in patients, women under the age of 60, is not only not harmful, but it can actually be quite beneficial because it can help alleviate the vasomotor symptoms of menopause, which is the hot flashes, the genitourinary symptoms, osteoporosis and bone fracture risk. It can help with mood, sleep, cardiovascular health. So tomorrow's meeting is pivotal because they can help change the narrative going forward and help 54 million women here in the U.S. that are going through menopause right now.
Now, I guess we should point out that it's not a one-size-fits-all when it comes to hormone replacement therapy. And hormone replacement therapy now is very different than it was 30 years ago.
It is definitely not one size fits all. We have to take into consideration the woman's entire medical history, their cancer history, their whether or not they've had a hysterectomy, and all of these can determine what type of hormone therapy they would be a good candidate for. But the bottom line is that practitioners were scared into prescribing these medications because of fears that are just currently unjustified, and this really needs to be revisited again.
So Marty McCary put a video out promoting tomorrow's seminar, in addition to his tweet on X. This is what he said about the findings since that 2002 study. Listen here.
Since then, no subsequent clinical trial has shown an increase in breast cancer mortality with the use of HRT.
So it was a one-time only thing. Apparently, a lot of people are questioning whether or not the science was accurate in that study. But it's like silicone breast implants. Remember the horrors of silicone breast implants, and then, some years later they said, "Oh, never mind, it's fine."
John, this is like during Secretary Kennedy's swearing in January, when I was watching, one of the congresswomen was saying, this is settled science. They were talking about another topic. But in my head, I thought there is no such thing as settled science. Science, by its mere definition, is to question and interrogate and go back and analyze. And that's what they did exactly for this study. And thankfully, they got better results.
But I guess the bottom line is, if you're a woman who's either perimenopausal or menopausal, go see your OBGYN and talk about it.
That is absolutely the case. Everybody should be talking to their OBGYN, especially early on, because that's a window of opportunity to really help prevent a lot of complications that may arise if they don't start the hormone replacement therapy. The problem is a lot of clinicians don't have the appropriate training, but legislation recently in the past year is hopefully changing that so that practitioners can learn how to manage menopause. There's been a huge dearth of information in that segment.
Yeah, I guess there's a lot of practitioners who say, I don't want to know about that. So hopefully that will all change as well. Great to see you, Doc. We look forward to the seminar tomorrow. Appreciate it.
Thank you.
Good
Thanks for having me.
All right, we'll see you next week.